Question number 2, Honourable Annette King.
My question's to the Minister of Health. If the government health expenditure has not kept up with all inflationary pressures, as he admitted 2 weeks ago, what impact has this shortfall had on patients?
Speaker.
The Honourable Pesatara Sam Lotu-Iiga.
Mr Speaker, on behalf of the Minister, when National came into government in 2008, the total health budget in the budget was $11.8 billion. This year, the health budget is a record $15.9 billion. This additional investment, over $4 billion, in tight times has seen more patients seen faster being treated. National is increasing and managing the health budget, whereas Labor blew the health budget, leaving a deep need.
Order, that part's unnecessary to the answer.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Why did he say in the House on the 23rd of July that no data was ever collected showing the number of patients returned to their GP without being seen by a specialist, when DHBs have been collecting such data for years, and it now shows large increases in the number of people not getting seen after referral by their GP?
The Honourable Pesatara Sam Lotu-Iiga.
Sorry, Mr Speaker, I just didn't catch the last part of that question.
I'm going to invite the member to repeat the whole question. Yep.
From the beginning? Why did he say in the House on the 23rd of July that no data has ever been collected showing the number of patients returned to their GP without being seen by a specialist, when DHBs have been collecting such data for years, and it now shows large increases in the number of people not getting seen after referral by their GP?
The Honourable Pesatara Sam Lotu-Iiga.
Mr Speaker, on behalf of the Minister, if he said that at the time, then that statement stands.
Order. Supplementary question, the Honourable Annette King.
Why have the number of patients returned back to their GP without being seen by a specialist increased in the Waikato DHB from 793 in 2010-11 to nearly 3,000 in 2014-15 if there is sufficient funding?
The Honourable Pesatara Sam Lotu-Iiga.
Mr Speaker, on behalf of the Minister, I don't have those figures to hand in terms of the Waikato District Health Board, but what I do know, and what the member knows, is that over the last 6 years, this government has spent more than $257 million at the Waikato District Health Board. In fact, that has funded over 124 more GPs in the front line, and sir, that has also led to 422 more nurses.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Why has the number of patients returned to their GP without being seen by an ear, nose, throat specialist in Waitemata DHB almost doubled in the past 3 years alone?
The Honourable Pesatara Sam Lotu-Iiga.
Thank you, Mr Speaker. On behalf of the Minister, again, I don't have that particular figure to hand, but what I can say about Waitemata District Health Board is that we've spent $310 million more in that District Health Board, and that has led to 195 more doctors being hired.
Supplementary question, Mr Speaker. Supplementary question, Mr Speaker.
Supplementary question, Joanne Hayes.
Thank you, Mr Speaker. Does he think that increased funding alone is enough to guarantee better services for patients?
The Honourable Speaker. Order. The Honourable Pesatara Sam Lotu-Iiga.
Well, thank you, Mr Speaker, and it's a good question. New Zealand has had 2 similar periods of increased health spending recently. In the last 7 years, the health budget has increased by $4 billion, as I said in the primary answer. And that's resulted in 60,000 more first specialist assessments, 50,000 more elective surgery operations, and 400,000 children benefiting from free GP visits and faster treatment for cancer. In the other period that I'm referring to, it resulted in fewer first specialist assessments, fewer elective surgeries.
There's no need to go for another. Supplementary question, the Honourable Annette King.
If there is sufficient funding in health, why in 9 DHBs alone have nearly 80,000 patients been refused first specialist assessment since 2010-11, In almost the same period of time when the health funding has not kept up with inflationary pressures, as the Minister said in the House.
The Honourable Pesatara Sam Lotu-Iiga.
Mr Speaker, on behalf of the Minister, I don't know which 9 DHBs that member is referring to, but what I can say in terms of first specialist assessments, well, you can tell us if you want, table it. What I can say is that there has been an increase in $60,000, first specialist assessments since this government took the Treasury benches.
Supplementary question, the Honourable Annette.
Does he believe delays in patients getting a specialist assessment and access to diagnostic procedures can lead to irreversible and potentially fatal outcomes for patients? If not, why not?
The Honourable Pesatara Sam Lotu-Iiga.
Well, with respect to the delays, that member has not tabled anything or any evidence
Mr. Speaker.
to suggest...
Point of order, the Honourable Annette.
Mr. Speaker, it's not what I've tabled. I asked a question.
Order.
If
I'm
did
going
he
to
believe
invite
delays?
order. I'm going to invite the member to repeat the question for the benefit of the Minister.
Does he believe delays in getting a specialist assessment and access to diagnostic procedures can lead to irreversible and potentially fatal outcomes for patients? If not, why not?
The Honourable Pesatara Sam Lotu-Iiga.
Mr Speaker, I'm not aware of these delays or what the member is referring to in terms of the types of outcomes that she's outlined. I haven't.
Question.
Table it.
Order.
Table it then.
Question number 3, David Seymour.